A difference or contrast between similar things or people. Similar words. Difference, contrast, dissimilarity, divergence, variance. Distinction.
Hello, friend, and thank you for joining me here today. Something odd is going on in public discourse. More and more commentators are ignoring important, and in some cases rather obvious, distinctions. As a result, they pursue line of thought that defy common sense and cause confusion, injury to others, or both. One reason for this widespread failure to make important distinctions is that for almost a century, the emphasis on all levels of education has been on mind stuffing rather than training in effective thinking. The result of this misconceived focus is that many people leave school without having learned how to think effectively. Another reason is that we have been persuaded that truth is created rather than discovered. Those who embrace this idea believe that their views cannot be wrong, so they see no need to make distinctions. So let's get into our distinction of the day here together. Distinction between placebo and nocebo. It is well known that placebo is a substance without medical effects which benefits the health status because of the patient's belief that the substance is effective, and that the nocebo is defined as a substance without medical effect, but which worsens the health status of the person taking it by the negative belief and expectations of the patient. How well are these terms really known? Placebo, a noun, a medicine or a procedure prescribed for the psychological benefit to the patient rather than for any physiological effect. A substance that has no therapeutic effect used as a control in testing new drugs. And a measure designed merely to humor or placate something. Researchers use placebo during studies to help them understand what effect a new drug or some other treatment might have on a particular condition. For instance, some people in a study might be given a new drug to lower cholesterol. Others would get a placebo. None of the people of the study will know if they got the real treatment or the placebo. Researchers then compare the effect of the new drug and the placebo on the people in the study. That way they can determine the effectiveness of the new drug and check for side effects. So, what is a placebo effect then? Sometimes a person can have a response to a placebo. The response can be positive or negative. For instance, the person's symptoms may improve, or the person may have what appears to be a side effect from the treatment. These responses are known as the placebo effect. Research on the placebo effect is focused on the relationship of the mind and the body. One of the most common theories is that the placebo effect is due to a person's expectations. If a person expects a pill to do something, then it is possible that the body's own chemistry can cause effects similar to what a medication might have caused. For instance, in one study, people were given a placebo and told it was a stimulant. After taking the pill, their pulse rate sped up, their blood pressure increased, and their reaction speeds improved. When people were given the same exact pill and told it was to help them go to sleep, they experienced the opposite effects. Effects of placebo are measurable, and placebo treatments can stimulate real physiological responses, from changes in the heart rate and blood pressure to chemical activity in the brain in cases involving pain, depression, anxiety, fatigue, and even some symptoms of Parkinson's. This means you simply believe you have taken a medicine and you get better. Just through your own belief. And power of suggestion and expectation. You can get an outcome without that medicine that is the same outcome you would get by using the medicine. Estimates of the people cure rate range from low 15% to a high of 72%. The longer the period of treatment, the longer the number of physician visits, the greater the placebo effect. The placebo effect is not deception, a fluke, experimenter bias, or statistical anomaly. It is instead a product of expectation. Human brain anticipates outcomes. The anticipation produces those outcomes. The placebo effect is a self-fulfilling prophecy, and it follows the patterns you would predict if the brain were indeed producing its own desired outcomes. Depression is a highly placebo-responsive condition. Mean placebo response rate in antidepressant clinical trials are 30 to 40%. That means every third person or more, just via a belief, via expectation, gets better. 30 to 40%. Think about that. Nocebo, a noun, a detrimental effect on health produced by psychological or psychosomatic factors such as negative expectations of treatment or prognosis. A sort of a negative placebo effect called the nocebo effect. It is what happens when you're given a sugar pill, told it is a drug that it has terrible side effects, then start to exhibit those symptoms. The nocebo effect can also occur when a doctor tells you a surgery or procedure could have negative results. Just knowing the risks could negatively impact your recovery, all because of the power of suggestion. Is there any proof behind the idea that the power of positive or negative thinking can actually affect your health? The verdict: if you believe a treatment will not help you, it probably will not, and vice versa. People have been noticing this for quite some time, says John Kelly, PhD, Deputy Director of Harvard Medical School's program in placebo studies in therapeutic encounter. Whenever you look at any randomized control trials, it is surprising how similarly the side effect profile for the placebo often mirrors the side effect profile of the effective active treatment. If the power of the imagination. If you ask someone to imagine a visual scene in their mind, you can see on an MRI that their occipital lobes, the parts of their brains involved with vision, are activated. If you tell people to imagine doing something physically active, you will see that the motor cortex showing activation, just imagining something, is enough to activate those portions of the brain associated with that thought or worry or pain. The pill may be inactive, but the side effects are real. About 20% of patients taking a sugar pill in a controlled trial of a drug spontaneously report uncomfortable side effects, and in an even higher percentage if they're asked. These effects are one kind of a nocebo, a word that means in Latin, I will harm, as placebo means, I will please. A doctor gave a patient a powerful drug, real medicine, but it was labeled as a placebo, and the doctor told the patient it was a placebo. So, believing that the drug was fake, patient reported that the drug was not effective. This again is a result of the patient's negative expectations. in how they perceived the drug would, or in this case, would not work. Do you even begin to understand how powerful this is? This is your own thinking. Your own thinking made a real medicine not effective because you did not believe it would be effective. Starting with the history of the placebo effect, and giving a review of the most significant studies reporting about the placebo effect from 1939 to 2013. The intention was to give an all-around look around this phenomena, discussing the neurobiological and other theories of its origin and concentration in the field of psychiatry, coming to a conclusion of these clinical trials and ethics regarding psychiatry. The placebo effect is a substantial role in most of psychiatric conditions, including depression, anxiety, addictions, and contrary to what might have been expected, schizophrenia. Likewise, the nocebo effect is not to be neglected, as the studies are being conducted to identify these factors causing it so it could be prevented. Patients with asthma were divided into two groups. One was given a bronchoconstrictor, which ordinarily makes asthma symptoms worse, and they were told it was a bronchodilator, which normally improves the symptoms. This placebo suggestion reduced their discomfort by nearly 50%. The second group was given a bronchodilator and told it was a bronchoconstrictor. The nocebo suggestion reduced the drug's effectiveness by nearly 50%. The frequency and the intensity of the placebo effect in clinical practice are difficult to determine, and the range of effects in experimental setting is wide. In many double-blind clinical trials of treatment, the pain or psychiatric disorder, for example, the response to placebo are similar to response to active treatment. And up to 19% of adults and 26% of elderly persons taking placebo report side effects. Furthermore, as many as 1/4 of patients receiving placebo in clinical trials discontinue it because of side effects, suggesting that a nocebo effect may contribute to discontinuation or lack of adherence to active treatments. Placebo effects have been shown to be associated with the release of substances such as endogenous opioids, endocannabinoids, dopamine, oxytocin, and vasopressin. The effects of each of these substances is specific to the target system, for example, pain, motor, or immune system, and the illness, for example, Parkinson's disease, arthritis. Dopamine release plays a role in placebo effects of the treatment for Parkinson's disease, but not in placebo effects of treatment for chronic pain or acute pain. Expectations, verbal suggestions, and framing effects, the molecular events and neural network changes underlying placebo and nocebo effects are mediated by expectancies or anticipated future outcomes. When expectancies are accessible consciously, they're called expectations, which can be measured and are affected by changes in perception and cognition. Placebo and nocebo effects are powerful, pervasive, and common in clinical practice. Neurobiologic mechanisms, information offered in relation to treatment, patients' expectations, previous encounters with a drug or a procedure with a therapeutic milieu can all generate these effects. Strategies to promote placebo effects and to prevent nocebo effects can improve therapeutic outcomes and minimize the unintended exacerbation of symptoms in clinical practice and in clinical trials. Do you realize the importance and significance of this information? Nocebo, a word that means in Latin, I will harm, and placebo, which means I will please. And all of it is just your own thinking. your own thoughts, suggestions, expectations. And there you have it, distinction. Do remember to subscribe and hit that notification button. Share this video with people you know can benefit from this distinction. Leave a comment and let me know, what are your experiences of placebo and nocebo effect? And if you feel you are ready to improve your self-awareness, your social awareness, self-management and relationship management even further, do check out my Master of Life Awareness program, Human Needs Psychology, plus Emotional Intelligence, plus Universal Laws of Nature. You can only experience what you are aware of. So, become a Master of Life Awareness. Links are in the description below. Thank you. Love and respect.